Diverticulitis or diverticular disease is a very prevalent problem in the U.S. What that means is normally the wall of your colon is typically very smooth when we're born, but through aging, poor diet habits, high-fat diet, low-fiber diet, and some family-related factors as well, we develop these small pockets or outpouchings on the colon. The good news is most of us walking around will have these outpouchings. We never know about it, but there is a small subset of patients that will develop some kind of problem with diverticular disease. That can usually present as one of two ways. One is diverticular bleeding, where patients will notice a significant amount of blood per rectum that may actually prompt a visit to the hospital. Normally this is self-limited and can be treated just by supporting the patient and obtaining a colonoscopy to ensure that there's not something else going on. The other way diverticular disease can affect patients is diverticulitis. That's when one of these pockets becomes blocked and actually becomes inflamed. There's a very wide spectrum of symptoms from diverticulitis. People are going to have mild pain, typically on the left side of the abdomen, that can just be managed with liquid diet and sometimes oral antibiotics. The other spectrum is that sometimes one of these pockets can become so infected that it bursts actually. People can have feces or stool leaking over the abdomen. This is a serious situation. Fortunately, it's very rare, but this can prompt emergency surgery, sometimes even requiring some type of a colostomy bag. And then there's everything in between where people will present to the hospital where they need some stronger antibiotics, rest their bowel, and then it's worth talking to a gastroenterologist or colorectal surgeon because you may be a patient that would benefit from elective removal of the diseased portion of the colon. When this is done on an elective basis, this can almost always be done without any type of an ostomy bag, which is always a big concern about this disease. Things you can do to kind of prevent this in your life is to stick to a high-fiber diet, try to minimize fat and processed foods, try to be as active as possible, and overall just live a healthy lifestyle. There are some old recommendations about avoiding things like seeds or nuts. Most of these have fallen out of favor, and we know that if you can really maintain a healthy diet and kind of eat things in moderation, you should be okay with diverticular disease.